Hi, I'm Dr. Matt Brengman. I'm going to talk about the gastric balloon. So the gastric balloon is really a different kind of weight loss device. Uh, we see diets, and most people have dieted. There's medications, and there's surgery. And the balloon is somewhere in between medications and surgery. And the balloon is really a novel device. It's approved for people who are between 35 and 80 pounds overweight. It doesn't require that you have significant medical problems, so it can be done purely for weight loss as in a preventative way. And it's extremely private. There's no incisions, there's no medications to take, and it's temporary. So it's something you do, it stays in for 6 months, and then it goes away. And so it is this sort of nice intervention where you are not permanently altered, but you have a significant tool to lose weight over a reasonable amount of time, 6 months. The balloon is placed at a procedure, but not a surgery. So it's at an endoscopy. The patient gets sedation. We go through the mouth with an endoscope, and the balloon is placed under direct vision. So we know exactly where it is and how full it is. It's very safe, and the patient goes home about an hour after the procedure is completed. Most people are going to have some side effects initially from the balloon. And so typically we do these procedures on a Thursday or Friday. People are home for the weekend, and then they're able to go back to work Monday or so. The balloon has its greatest effect the first 3 months that it's in place. We see people losing about 15% of their body weight over 2.5 to 3 months. The balloon stays in, though, a total of 6 months. So while the patient is losing the weight, once they've lost their weight, they have 3 or more months with the balloon in place to kind of consolidate their weight loss, get used to their new weight, get used to the amount of food that's required to maintain that weight. How do I travel? How do I go out to dinner? How do I interact with my friends in this new way where I'm going to be eating quite a bit less food than maybe I used to? The balloon also allows a patient to enjoy their regular activities. There's no alteration in the anatomy. The food you eat goes down the normal way. So you can enjoy regular foods, a glass of wine, maybe a cocktail, and it's not going to affect you in any different way than it did prior to your weight loss, other than you might be lighter, so you want to maybe not have as many drinks as you might have had. Once the balloon is removed, the patient is back to their normal life. And that mechanical effect of the balloon will go away. Some people are going to keep that weight off. They will have been able to lose weight, make the changes around food they need, and their hunger remains relatively well controlled. And whatever intervention they've made around exercise and meeting with the dietitian and psychologist, they continue to do that to keep their weight down. Some people will gain a little bit of weight. If you have the balloon removed, you obviously will be able to eat a little bit more right away. People will respond to that with greater hunger, and they will gain a few pounds. But many of those people will stop after they've gained 2 or 3 pounds and continue to keep the rest of the weight off. Some people will gain the weight back. The balloon is a very strong mechanical effect on the stomach. Not only does it take up space, but the stomach doesn't empty like it normally does, so the food hangs around a little bit longer. People get greater sense of fullness and satisfaction from small meals. And for some people, that is the difference for their weight loss. For that group, they might gain all of the weight back after the balloon, and that definitely does happen. But that group also learns a valuable lesson, that maybe a permanent intervention would be better for them. Something that permanently reduces the size of the stomach or the feelings around hunger would be able to get that weight off for 5, 10, or even 15 years. And so the balloon's a great tool. It provides a lot of great information. It works very well, and it's incredibly discreet.